Hi, my name is Yasu from Japan, and in my video I do hitorigoto, which means talking to myself. So today I'm talking about, not really talking about, I'm answering to the question that's posted on the comment for one of the videos that I posted, which is the question is, so in order for you to get hormone replacement therapy, you should have done some kind of tests. What kind of tests did you do to be approved for getting the male hormone replacement, testosterone replacement therapy? That was the question. The answer is quite simple in Japan, blood test. So when I was going through a lot of things last year, and of course I have seen multiple doctors back then, and then everything was officially diagnosed with multiple disease or sickness. One of them is I'm suffering from the malemenopause. I think the medical terminology is low testosterone, some kind of. Basically, my testosterone level is way too low, which is not supposed to happen because for male body, biologically and then genetically, of course, as male ages, our testosterone level goes down, but it's not supposed to drop dramatically. And then if it drops dramatically, that would actually lead a lot of similar symptoms of depressions, and of course low libidos, low sex drive, and then so on. So because I felt so not myself and everything, I actually went to see a urologist and explained everything. And then based on my symptoms for my urologist, I seems to fall into a condition of suffering from male menopause, super low testosterone level. To officially diagnose and check and everything, he had to run the blood test. So basically, he took my blood and they waited for 1 week, and then I came back to the hospital, and then he was showing me the result of my blood test, and then the testosterone level is way too low, really low, like the level of the 80 years old people. So he was very concerned, and then urgently suggested me to get the testosterone replacement therapy. In Japan, there's only one option that's covered by the insurance, which is injection. So I started to do so right away. But of course, there's a consultations because the side effect is something that a patient needs to be informed and then take everything into consideration in order for them to agree to get the testosterone replacement therapy. So, for example, it could damage the liver or kidney or prostate, and also it might cause infertility and so on. So, if people are planning to have a babies and everything, going through testosterone replacement therapy is not recommended. And also, if people suffer from the prostate cancers or kidney not kidney functioning well or liver functioning well, then they are not supposed to get testosterone replacement therapy. So when the initial diagnosis for based on the blood test, except the testosterone level, in my case, everything is fine. My liver, prostate, kidney, everything is fine in a normal range. So I started getting the testosterone replacement therapy covered by national insurance in Japan. So that's how it goes. So if you feel that you're depressed, like feeling something that you're feeling down, not much energy, or you don't have that much libido or like sex drive, if you feel something is not really right, I recommend you to just simply go to a urology hospital in your neighborhood, tell them your symptoms, and most likely they will agree to run a blood test. It's really easy, and then you will find out a week later whether you would suffer from the super low testosterone situations or not, and then you can decide how to proceed based on your situations. Because I really digged in a lot of information and data for this super low testosterone health conditions, and then it's not biologically and then genetically programmed in male bodies. So for females, once they reach certain ages, then the female hormone level drops dramatically, which is cause them to suffer from the menopause. But once body and the brain gets adjusted, what would happen is that male hormone in a female body will dominate. It has more compared to the female hormone. That is why, as programmed in biology and in genes, females become more active once they get through the menopause. For male bodies, of course, when we age, the male hormone production would decrease, but it's so graduate. It's not supposed to be dropped dramatically. So if this happens, that means the patients with super low testosterone level suffer from medical conditions. So it's highly recommended to go through treatment. However, there is a side effect and in some other aspects of considering, because if you especially want to make a babies and everything, you're not supposed to go through testosterone replacement therapy. It's really up to you if you want to proceed. But the first step is, if you don't feel well, just go to stop by the urology hospital in your neighborhood in Japan. Tell them to run a blood test, and then you will find out. And based on your circumstances and everything in planning, you can decide how you wish to proceed. And if you know what to do, at least it gives you certain directions. It's better than living with uncertainty. So that's my recommendations. And as I keep saying, health really matters. If we don't have a good health, we cannot get to enjoy our lives, which is so sad. That's exactly what I have been going through since 2022. So I hope you're not gonna you don't have to experience the same thing as I do. So please take care of yourself. And then I hope to see you in my next video. And until then, please look after yourself well. So for now, Jane, bye. Bye.